Bayelsa State is 35% rural area. So how does these campaigns that are being stationed in the capital reach out to the masses that are out there in the jungles?
Thank you very much. But before I address that, the other question is, are vaccines good for all body systems and all of those? Yeah. We vaccinate all children, but then when you see a severely sick child, you don't vaccinate. We treat the child before vaccination. Immunocompromised children, we take them specially and vaccinate. Malnourished children, we treat them and vaccinate. So we are cognizant of these facts when we see these children. Then the data of 95% Bayelsa being flooded may not be very correct. Be water riverine may not exactly be very correct. However, we have over 260 health facilities, primary healthcare facilities in the state that offer these services in almost every community. So every ward, the 105 wards in Bayelsa, have a health center. In the 8th local government, we have 8 directors and primary healthcare authorities that exist thereof. So the coordination and dissemination of information, as we say it here, it cascades down and it goes further. So this information is carried by the health promotion officers at the local government level and sent to the communities. In most communities, we utilize the community radio system or the town announcers in these communities. So the information, we cascade it down. But then that we may not be the ones doing it at the rural level does not mean that the message is not passed on. There are also jingles that are being sent. We also have a podcast studio in the primary healthcare board where we generate information and also circulate through the social media, as an easy means to convey this information. Then again, in this campaign with how vaccines will move, whereas the state government is funding vaccine push via land means, there's also the aerial drone technology for vaccine logistics managed by Zipline in Bayelsa, of course in partnership with the state government, that pushes vaccines to the last mile in far-flung communities and difficult to reach areas. I'll tell you, in areas that you need 5 to 6 hours boat travel, like Kolwama, you can have vaccines delivered to them in less than 1 hour.
Interesting.
So there are several means to disseminate this information. As interesting as it is, we can even transport ice pack to facilities that do not have, solar direct drive. No, once they call that they need ice pack, Zipline can transport that in less than an hour to those areas for all of these. So the conversation is robust around preventing this. And of course, the state government is taking a huge lead in this, ensuring that nobody is left behind in this conversation. And our stock out rates for vaccines, say, facility, want to do vaccine. No, we don't have vaccine. Our stock out rates as good as less than 1%. The target is to have 0%. But for administrative convenience, let's give maybe 0.0 something, But then, this is as good as the system is in ensuring. The only part of the system that has a problem is the people receiving. But for it to get to you, the institutions, the structures, the interventions are ready. That is why I'm ready to beg and plead. Please avail your children, yourselves, this opportunity to get vaccinated.
The last caller, you should not be afraid. It's going to go down everywhere. It's only left for you to make yourself available for the vaccination. This other one is quite funny. Anyway, this one's from A.B. Charles. I guess you're just trying to take it on a lighter note. It's scary somehow, as in the mode of transmission like kissing.
That's for the others, of course.
For suspected cases.
Okay. For suspected cases?
Yes, of course.
Oh, great.
Where kissing can be, sometimes people are sick, you want to do a mouth-to-mouth resuscitation at this point. This could be veritable means to transmit. And even though that's not a very common practice anyways, nobody wants to kiss or resuscitate with the mouth, but it is one of those.
Yeah.